out surgically because they were so bad, trying to save the life of the horse. And turned out that Pasteurella was the bacteria that most often was in there. But it was the veterinarians doing it. I mean, and the staff. It just wasn't working right, and it was tragic. But finally got it under control. Okay. Well, if you want to prevent these problems, besides just the protocol to put in the catheter, you got to make sure that you take the time to clean the injection sites and the vials before you use them. Swab them off with alcohol. You don't get any bacteria. If you don't change the IV catheters when they need to be done, you got to set up a protocol. You say, okay, even if things are going well at 48 or 72 hours, it's going to get changed. And yeah, it's more cost to the owner, but in the long run, it certainly does make things run better. And we make mistakes. We contaminate an IV set, and we say, it won't matter. It'll be all right. Patient's only going to be on another day or two. Now, you got to stop, and if you contaminated the set, you got to change it. And next thing is failure to recognize and treat phlebitis early. You got to be looking at these. You got to be looking at the site where the needle goes in the skin, and you got to see if there's any phlebitis started. And if there is, what do? You discontinue that catheter and you change to a new spot. You don't say, well, it'll probably be all right. I'll look at it tomorrow. You can't do that. And then using unsterile or contaminated fluids and additives, just begging for a big problem. Another one that we found is that if you don't limit the movement of the IV catheter at the skin where it goes through the skin and where the hub sticks out, what happens is that if it's moving so that a little bit of the catheter is showing and then it goes under the skin and then it gets pulled out some and then it goes under the skin. And what you're doing is comes out, gets contaminated with bacteria, and then you're just pushing the bacteria under the skin. Then it follows the catheter down and then causes the phlebitis. And another thing that we found is that we were bandaging, remember I told you about that, bandaging the site in the mistaken belief that this was a best practice. But it wasn't. Let me tell you why. One is that you couldn't see it. So it's like out of sight, out of mind. And so the phlebitis got going and got established before it was recognized because we didn't want to take the bandage off. The other that was more important was that, I think more important, is that the bandage around the neck was grabbing hold of the catheter hub. And so as the animal moved its neck, it was taking that catheter and doing what I just said. It was moving the catheter in and out, and so it was coming out, getting bacteria on it, and going back in. So it was causing a disaster that way. So we don't use any bandages. So you can see it, and it's undisturbed, and we have less problems. So this is just a picture of the catheter going through, and the way it's done is just a couple little sutures holding it in place. There's nothing dragging on it, so it's holding it in place. It's down against the skins. There's no catheter showing. It's not moving in and out as the horse moves, and it's much less complications. Plus, it just works a whole lot better. Well, okay, enough of that. Let's see. What have we learned so far today? You are better prepared. You got idea how to make sure that your patients get the water they need. You've learned that the maintenance of water electrolyte balance is one of the most important treatments available. Of all the things, of all the drugs I have available to me, I'm absolutely convinced that intravenous fluids are the ones that save more patients for me than anything else. You've learned how to estimate water needs. Got that graph you can use. You can now know how to review the laboratory serum electrolytes and determine what solution might be best. Make recommendations. Make sure that the veterinarian has looked at them and you've all agreed that that's the best thing to do. You understand that you got to prevent all the complications associated with IV catheter and IV fluid use, and that you can do it. But you can't do it if it's helter-skelter. And you also know that you've just touched the beginning of the things that you might want to know to be able to be the very best technician that you can possibly be. Well, I would urge you to visit our website. That's www.internationalwind.com, and you'll find a load of information there. You'll also see, if you don't use them already, some of the IV sets that we have that will make your life a whole lot easier. There's a couple 5-minute videos there that you can look at, depending on what issues you're working on, that will give you an idea of some product things that you might not use already. So I encourage you to go there, take a peek. It's the things that we do now, and that might be of great help to you. And I was asked to tell you that we, International Wind, helped to sponsor this, and that NAVTA is the association that co-sponsored it. And if you aren't a member, for gosh sakes, I would urge you to join them. They do a lot of good things for you. And there's their website. And about the questions, there's a couple ways. One is that you could ask the questions along the way, and I'm going to answer them by the 25th for you. Or you can email your questions to Andrea, and she will make sure that I get them so that I can answer them, and we'll post them on the NAVTA site. And here's the a couple addresses for you to be able to take the quiz that's associated with this, and I think that goes along with getting your race hour of continuing education. So there's that one. I'll leave this up here for a bit. And there's also one for feedback to help us do things better. And I'm not a tweeter, so I'll just say that read the one about tweeting. I guess it'll give you a place to go. So that's what I wanted to share with you, and I hope that you feel that it was a good deal, and you'll come visit us again, and certainly go to the NAVTA site and keep up to date with what's going on. So I will turn it back over to, I think, Sandy. Is that Sandy? Are you going to take it?
Yes, I am. Thank you very much. I really appreciate that. I hope that everyone enjoyed the webinar today. You will be getting an email in the next hour with a link to that CE quiz, as well as a link to the survey and information about how to, if you think of an additional question or something, you can email editor@navta.net, and we will get those questions to Dr. Donowick, and we'll get those answers posted on the NAVTA website. We'll put the information online and on Facebook and on Twitter and in the next e-newsletter and things like that, so that you're sure to have access to that. We've also recorded this session, so the archived slides and audio will also be available on our website. We hope to have that up by Monday. So if for some reason, you came in at the tail end of it and didn't get to listen to something, or you wanted to go back for reference, it will all be available on our website. So thank you all very much. Thank you to International Wind again for sponsoring this webinar. They are also listed on our website. If you want to click to them through the NAVTA site, I would encourage you to do that as well. And we will hope that you all will join us again for our next webinar. Thank you.